Hello, everyone, and happy Wednesday. Welcome to Wellness Wednesday Inspiration. I'm Dr. Linda Marquez Gedine, and you probably noticed by now that I'm missing my co-host today. So I am going solo. However, I still look forward to every single Wednesday because I learn a lot. I get to connect with some amazing people besides my co-host. However, things are always changing in life. So today we actually have a returning guest, and I was trying to pull up all the information. I know you're going to be excited about this because personally, you know that we do things in our office naturally, drugless, and we encourage a lot of our patients to do that. Sometimes medication is necessary, sometimes intervention other than a natural way that I can provide is needed. So I usually refer a lot of my patients or practice members for that. So today we are going to talk all about hormones, okay? And I have Dr. Robert Yoho. Actually, he's a retired physician, had a very busy practice and as a plastic surgeon. However, his expertise, his knowledge, and how he used hormones in his office and with his practice, I think is going to give us a lot of information. If you have not read his book, Butchered by Healthcare, it is amazing. He also has Hormone Secrets, the book, but both are excellent, very informative, and he writes it for it's more for you to understand, but also to kind of partner up with you, because that's what health is all about. It's just about partnering up with the doctor. So if you have a doctor that's not listening to you, then it's time to find a new one. Anyway, so we're going to bring Dr. Robert Yoho on right now, and let's make sure we can see you. How you doing there?
I'm fantastic, and I really appreciate that kind introduction. Linda, you don't have to doctor me. Just call me Robert from now on. I am retired, and I have to interject this unfortunate disclaimer, which is, a legal thing because of all the lawyers we have hanging around. This is not meant to be specific healthcare. You need to get a licensed provider to help you with any medical problems you have, and use this information at your own risk. That's about as broad a disclaimer as you can make. So I apologize for that, but and I believe in what I say. And I've had you'll see I have 500 references in each book, but I'm forced to say that. So thank you.
Oh, absolutely. And the books are, I like to have patients say, these are guides for you. You need to investigate both sides. And I think that's why, I wanted to bring you on because, well, first of all, let's just define what are hormones, because the way I define it to patients, I always say that's the language of communication with your body, whether you want to lose weight, whether you want to sleep better, whether you have sex drive, anti-aging, energy. I mean, your body depends on hormones and for them to function at their optimal capacity.
Linda, that's a great definition. And the thing that listeners should understand about hormones is we have 100 plus years of studying hormones, and we know an awful lot about them. And they are entirely different from the sometimes toxic proprietary drugs that are dreamed up by big pharma. These things are absolutely natural in certain forms, in the forms you can obtain them. And that's why we call them bioidentical. They are identical to the exact substances found in the human body. They have exceedingly positive effects if used properly. And the whole thing is being sort of concealed by the industry and the FDA, which is essentially an organ of industry. It's just an extension of the industry because their pay comes from industry. And so the bioidentical hormones can't be patented, with a few exceptions. So they're not massively profitable for big pharma. So that's sort of the brief introduction. I will supply, in this book, I supply the evidence based on almost a century, in most cases, of experience with these drugs, a century's worth of study, over a century for thyroid. It's like 120 years of studying thyroid. It's crazy. And these things are still run down. And the proprietary substitutes, which in many cases are outmoded or are inferior, are promoted instead by the patent manufacturers.
Mhm. So let's unpack the thyroid one first, because that is probably one of the most common prescribed hormones as far as I've seen in the practice, and I can't prescribe it. However, as I mentioned earlier, I do refer out, whether it's a naturopathic doctor, an integrative practitioner, that they can, and when it's necessary, because it's not always necessary. However, it can save your life and make your life better, because the thyroid, we know it's the master gland. I always call it the master gland, the fat burning gland in the body that really is like the CEO and how everything else is working. So can you share a little bit about that?
That's another excellent characterization. It's the master and commander of the whole system. And thyroid is a bit more difficult to prescribe properly than the other hormones. The other hormones, you can almost go in a table, look up what to prescribe, and get excellent results, 90+% of the time. But for thyroid, things have to be adjusted, and it is possible to use a little too much. But the hormone doctors, the people who are specializing in this, now believe that a third of women over 40 would benefit greatly from at least a small amount of thyroid. And the endocrinologists, who we have to respect as having the most training and experience in this area, they often they take quite a different view, and they think that only smaller or limited amounts of thyroid hormone replacement is appropriate. Now, these guys and women have a conflict of interest, and that's because their society has been paid millions and millions of dollars every year by the patent or formerly patented thyroid medication called Synthroid and other patented T4s. Now, thyroid is basically two different hormones, T4 and T3. T4 has 4 iodines and T3 has 3. Now, I'm sorry to jump into the weeds on this one, but you've got to get some basics down if you want to understand it. And I wrote it up. I'm sure it's easier to understand in Hormone Secrets than what I'm going to say. But, of course, so the endocrinologists usually prescribe only T4. And unfortunately for their patients, T3 is the more powerful and more physiologic and more effective hormone. Now, in theory, the T4 gets transformed into T3, but that's just not the case for many people. And T3 has to be prescribed. Now, we have pork thyroid, which has been run down by industry because it's so cheap to produce. You just take the thyroids out of pigs and you put them in pellets. And it has been used since the late 1800s effectively for thyroid disease. And it's still probably the best thyroid medication, although it contains both T3 and T4 with some inconsequential pork thyroids. Now, so it is possible to give T4 and carefully adjust the amount of T3, and both are given as a synthetic form. But it's easier to start off with pork thyroid in most cases. Now, this is individual and is very stylistic, and medicine is an art, especially for thyroid. But if someone just checks your tests and says, you're fine and you don't feel great, you probably want to pass on this person and go on to the next provider, because there are a lot of people with some degree of expertise in giving thyroid. And this thing, once you get tuned, in other words, you get your exact dose down of the T3, T4 combination, or perhaps the exact dose of porcine or pork pig thyroid that you need, you can stay on that stuff for years and just possibly get checked once a year with just a little checkup where they ask how you feel, whether your energy level is okay, whether you're having any palpitations or anything like that. And that may be all you need, and you can cruise for years. But patients who get started with thyroid should be patient with their doctors up to a certain point. And if you don't feel good after 2 to 3 months, you may want to skip on to the next one. After all, there are a million of us in the United States. You can
Yeah.
get another doctor pretty easily. And I have ways you can find people who are expert in this sort of thing in the back of my book.
Okay. And the interesting thing, and because I have a free ebook on my website about a lot of, like you were sharing, most doctors don't even test properly. So you've got to make sure the TSH, free T3, free T4. I'm seeing so much Hashimoto's right now that even reverse T3 antibodies are also checked. So I mean, that's like the first step. If your doctor's not willing to run those labs. And of course, you have to make sure vitamin D levels, ferritin, iron, B12. And in addition, because those are also important with thyroid function, I'm like, run. You have to find, but the beauty of it nowadays, you can go on, you don't need a doctor's, prescription to go get lab work done, a lab order. You might pay a little bit more, but is it worth it? Because at least you can have the information, you can have the results. And like you said, look for a doctor that's willing to prescribe, just not the T4 hormone, but the combination. Sometimes they do better with T3, or maybe they just do T4 and then they supplement with the T3 and just dosing. And it is an art, because I see that a lot with patients. But women, especially when they go through menopause, their thyroid starts to downregulate. And I've seen that a lot in just running full labs. And you probably saw that in your practice a lot with women that maybe they were depressed and they felt, oh, if I go and get breast implants or I do this with my body, I'm
Exactly.
going to feel great. I'm going to feel sexy. And they're still depressed. And even like their cholesterol levels could be elevated as well. So then you put 2 and 2 together. It's like, maybe we need to run and see what the thyroid is doing.
Linda, that's a very sophisticated analysis, and it's maybe more sophisticated than what I said in the book. And I would maintain that the TSH, if we're into the weeds a little bit here, so let me explain one little crazy thing about thyroid. The TSH is a reverse measure of where your thyroid is at. It's nonspecific, and it basically is not a very good test. And if we use that, like the endocrinologists do, to monitor thyroid care, we get confused. What we need is a measure of T3 and T4, and we want to watch those, push those up near the top of the normal range,
Mhm.
and then we usually get a very good clinical response. The patient has to be watched like a hawk, because the thyroid it can cause problems, but the problems the endocrinologists are afraid of are primarily Graves' disease, which is 3% of the population. And Graves' disease is a situation where the thyroid goes crazy and produces too much thyroid hormone, and it can't be easily turned off. It requires several months of therapy with different kinds of suppression drugs. And during that time, patients can get significant complications such as osteoporosis and atrial fibrillation. But these things are just not a problem with oral thyroid supplementation for low thyroid, because if you take too much of the darn stuff, you're not going to feel very well, and you'll throw it in the trash, or your endocrinologist or your primary care doctor or your hormone doctor can say, cut your dose down and be sensible about this thing. So I would recommend that patients always be patient with the process, and if you don't think that you're going anywhere appropriate, if you're not feeling gradually better, get another physician or nurse practitioner or whatever.
Yeah, I've had great success with referring out to a lot of nurse practitioners more than an
Yeah,
endocrinologist.
they
And
focus on it. The
yes,
endocrinologists are too busy looking at their billing. you know
exactly. Yeah.
yeah.
So, I mean, I love what your perspective on all that is too, with, the importance of the thyroid, because that has to be dialed in. And so because I see a lot of women and we have a lot of, females, it seems like they're the ones that are just really searching. They know that something's just not right, especially they start getting into their age of like 40s. It's just like they're getting close to that empty nest syndrome, even in their 50s, as some women. So let's talk about hormone replacement therapy, because that's very controversial. And my perspective and my opinion about that 10, 15 years ago has totally changed from now. And I think there's a lot of, um, as you were saying in your book, how did you, there's a lot of evil speaking about it because one, because of the Women's Health Initiative, with these women getting cancer, and so can you kind of let's unpack that a little bit because there's natural, our bioidentical is really natural, and a lot of women, because I remember my mom, they were prescribing Provera to her,
Yes.
and so can you chat a little bit about
Okay.
that?
So you brought up about 5 or 6 questions. If I go
I
off the
know.
track, just let me know. But if evil is not something, I try not to use that word, but corruption is the word I use. And
There you
this
go.
is my other book about medical corruption. And the Hormone Secrets book is a considerably happier book, but I still have to address why these drugs are suppressed. Now we can't. There's nobody's actual fingerprints on the crime, right? And it is a crime, and I'll explain that in a second. But it sure looks like the big pharma is benefiting because they sell all these expensive antidepressants and all this other crazy stuff that hardly works at all. And the best introduction to this, the thing that will achieve credibility for your listeners, for me, is Alzheimer's. Now, women who start on estrogen at the time of menopause and stay on estrogen cut their chances of Alzheimer's by a massive amount. Some studies suggest 80% decreased in Alzheimer's cases if they get on estrogen and stay on the darn estrogen. Now, this is not widely known, but it's such a burning issue in my opinion because Alzheimer's might be the most expensive disease in America if you count long-term care costs. This is outrageous. So I stuck 75 references in Appendix C of this thing, and I printed them in the book because I wanted everybody to understand this one point. And if you understand this point and you understand how this idea has been suppressed in favor of drugs that cost $1,000 or $2,000 a month and don't freaking work, or at least even their inventors have a hard time claiming with a straight face they work very well. These are the Alzheimer's drugs, right? The big pharma Alzheimer drugs. So just with that brief introduction, yes, um, I was a cosmetic surgeon, and many plastic surgeons operate on a string of depressed patients without even considering why they were depressed, right? And
Yeah.
so I couldn't stand to do that because I had some primary care background. And so what I did was I trained and learned about and then started prescribing bioidentical hormones, which, I mean, that's an all good story. And the fact that it's controversial is an industry suppression story. In other words, it's between the FDA, which has stuck these black box warnings, false black box warnings on progesterone, estrogen, and testosterone for heart disease, strokes, and cancer. I mean, it really is truly outrageous because it's a pack of lies from start to finish, with a few small exceptions which you have to learn about. But I prescribed hormones, and I got to tell you, this is not politically correct, but I saw better results in women than men. Now, most of my patients, of course, are women, but the results were nothing short of miraculous because women fall off a hormonal cliff at 50, a lot of them, and they just
Mhm.
feel terrible, even though many of you guys are tough enough to power through it and act pretty well despite horrible symptoms. And I mean, I saw many, many tough women who I didn't understand what agony they were in until they filled out my questionnaire. And everything on the questionnaire was on the far left side of the, feel terrible, no sex, muscles are wasting, all this stuff, not so alert, sleepy all the time, depressed. And they would tune up in a few weeks. And I used the cheapest hormone therapy because I did it for free, right? I felt so sorry for them. I asked them if they were interested, told them about it. And of course, if they weren't, I don't argue. I try not to argue with women. I usually lose.
Yeah.
But if they wanted a trial, I told them it would probably help them recover from surgery because the drugs are anabolic. They help surgical recovery. So I
Mhm.
gave them a tiny little testosterone pellet that lasts 3 months or 2.5 months through their belly button where they can't see the scar. And within a couple of weeks, they'd be back in follow up and they'd be transformed. I mean, their spirits and even their sexuality and and they would find out later that they felt a lot better in a lot of spheres. So that sold me, and it wasn't expensive for me to do. I was doing the surgery anyway. The pellet cost $20, and I would just, if they consented to it, I would give them a trial of that therapy after the surgery, and it made a huge difference. The men, of course, we get the dwindles over 50 or over 40 or whatever it is, and it's a slow slide. But the women, it's just super dramatic. And if they got testosterone injections and they were willing to do that, that cost $1 a week. It's free, So why this stuff is being ignored, I mean, it's an outrage. It really is an outrage because it works. It helps health, probably makes us live longer, and I mean, it's super dramatic.
So, even in addition to hormones, though, I really think that we need to kind of address this, because even in light of everything that's happening in this world right now with COVID, and who is it really impacting, we really have to also look at lifestyle. I'm such a big proponent, always have been, of diet and exercise. Gosh, since I was a teenager. You probably remember Jack LaLanne, because I always ask people, so do you remember Jack LaLanne? It's just like, he was one of my mentors. That's why I've always implemented diet and exercise. And so even with a lot of the women and the men that I've seen in the practice, I said, hormones by themselves, even for some people, because they would say, well, it didn't work, it's not working. I'm like, well, are you still doing these other changes? What about your mindset? Are you getting your sleep dialed in? Do you have a good attitude? Are you eating cleaner? Because hormones also, they, like as we mentioned earlier, they are the language of communication. And we have to realize that environment also plays a role. And the body is always, I would say, the body is always listening to the mind. So we can even create a lot of issues with ourselves just with our mindset alone. So is that something that you would also tell your patients as well? It's just like, just because you're taking testosterone, like some men, they're still eating crap and they're still eating all this sugary stuff. And then we have aromatization, and you got men with man boobs. So was that something that you mentioned a lot with your patients, with working with that?
You're sophisticated, and you've touched on a whole lot of stuff. And I've got a chapter on diet and hormone secrets, and the FDA is probably responsible for our obesity epidemic. You probably haven't heard that anywhere else, but the FDA has advocated these high carbohydrate diets for 30 years, along with some other 3-letter government organizations. I'm from the government. I'm here to help, right? And so the high carbohydrate diets and the lack of animal fat and animal protein in our diet probably has been almost as bad a thing as all the nasty drugs, half of which don't work or are actually harmful. And the FDA is responsible because they are in the pockets of these industries. It's a regulatory capture situation where the regulatory is captured by the economic interests. I mean, it's really crazy. All this approval of this fake vaccine, it means absolutely nothing. There's no science behind it, and it is part of the regulatory capture thing. They're paid off by these pharma companies who are producing this thing, and so diet and exercise, that's the question. And of course, diet is critical. And I think if we can get away from our carbohydrates, increase the saturated fats and increase the animal fats, which have now been proven to decrease heart disease, and cut out as much of the carbohydrates if we can. If you're really fat, you better just go on a straight keto diet and cut out all carbohydrates, because it works. You know that, don't you, Linda?
Yes,
Yeah,
absolutely.
And so as far as exercise goes, it helps. But in my opinion, in order of importance, it's hormones or diet, and then exercise is secondary. Because if you get your hormones right, very few people don't respond to this. You can have other issues. Maybe you really have a psychiatric issue of some kind. But for the most part, people who think that they have psychiatric issues at the time of menopause, they think they have existential issues. They think they have situational issues. They're absolutely wrong, because all they need is a little freaking testosterone pellet and maybe some progesterone and the other hormones, vitamin D. So that's my answer to that. I think that exercise is a distant third, but it's also important. I mean, it's in your top three.
Absolutely. Yeah, yeah, definitely. Let's talk a little bit about progesterone, because even, let's just say, because there's some women that are like, I don't want anything in my body. However, progesterone, I mean, gosh, that has been a lifesaver for so many women. And I wanted to talk a little bit about that in respect to some women that use it as a part of their cycle because they're getting a lot of hot flashes, PMSy, mood swings. And then the woman that, let's just say, now is in menopause and hasn't had a period for 2 years. So for the woman, I mean, because you would use it differently, and it's not too late, even for the woman that's been suffering for, let's say, 2 years with the headaches, the just all the PMS that's now into menopause, and they just don't feel like themselves. Can you unpack a little bit about the progesterone?
Progesterone is critical. Now, some clinics use only testosterone, and that's okay. It's not as important. But if you get estrogen, you have to take progesterone if you have a uterus, because it does increase the estrogen increases slightly your chances of uterine cancer. That's one of the only caveats with bioidentical hormones. Along with, if you take testosterone, your man, you can get impotence. I'm sorry, you can get infertility, and your testicles shrink, and a few other things. But that's one of the only important caveats with hormones. Other than that, it's almost totally safe. Now, progesterone, the quantity almost doesn't make any difference. You can take 8 or 10 200 milligram progesterone every day, and it's not going to hurt you at all. You treat yourself to symptomatology. And if you're having trouble sleeping and you're menopausal, you take that stuff at night and take it until you don't have any trouble at all. And you're sleeping through the night. You're not groggy in the morning. And progesterone, it protects against uterine ovarian cancer. It has many other positive effects, and it's the calming part of the hormones. It mellows you out, and it turns you back into the younger woman that you used to be if you are, if you're postmenopausal. So it's super important. There's two kinds of progesterone available from the compounders: the micronized kind, which does cause sleepiness and should be taken at bedtime, and then there's the suck and swallow troche, which is a melt in your mouth kind of a thing with different flavors. So if you need to take it during the daytime because you're so cranky, and that's what you measure it against. You can take these things throughout your day as sort of pacifiers, and you'll feel like you did 10 or 20 years before. I mean, you'll feel fine because your progesterone levels are higher. These levels should be checked of estrogen, testosterone, progesterone. And as Linda mentioned, you can get these over the counter. You can bring these to your provider. And where you get them over the counter is lifeextension.com. You pay your couple $100 and they give you a lab slip, and you go into a local blood drawing station, and then they email you the results. So that's progesterone in a short nutshell.
Okay. So is there a time where it's too late for a woman to start hormone therapy?
Well, that's one of the fictions that has been developed by industry, in my opinion. And so I don't think it's too late. The results are not as dramatic if you're 65 and you're starting as when you're 50. And there may be some theoretical problems, but the problems are tremendously outweighed by the good that it does. And these are the people who need the protection more. They need the estradiol protection against heart disease. And just because they're more likely to have a heart attack overall doesn't mean that they shouldn't start it. So that's my opinion. There's other opinions out there, but I've read an awful lot of this stuff, and I really believe that you should start and continue bioidentical hormones from menopause or after menopause for the rest of your life if you want to do the best that you possibly can. You certainly don't want Alzheimer's. So you try to prevent that by starting it long before.
Yeah, and that's a whole different conversation in there with Alzheimer's and type 3 diabetes, and
Yeah.
that's a whole different conversation. There was also a couple other questions I had here with, I've really been digging into a lot of the hormone replacement, a lot of just going on websites, following doctors. Can you share a little bit? Because this is not really talked about a lot. Yes, we hear a lot about, okay, estrogen and progesterone and testosterone, especially a lot of women that, those are the three, they say the amazing trio. But what about growth hormone?
Well, growth hormone, it may be our best hormone of all. I mean, it may have life prolonging and health improving properties, but growth hormone has been made almost impossible to prescribe, and
Mm,
it's outrageously expensive. And I mean, it just, that's another sad situation. And it requires injections, so it's a little bit more of a hassle, but you can use a 30 gauge needle. Um, I mean, we've had it for 50 years roughly, and including
mhm,
cadaver growth hormone, which had a problem because it rarely but sometimes communicated an infectious disease called prion disease. But I mean, probably for 40 years we've had synthesized human growth hormone, the same as is in our body. But there have been uh, statements by the FDA that it's illegal to prescribe in non, there's a few approved indications. So this is the prescription of an approved drug for a non-approved use, right? Which is probably half the drugs we prescribe are prescribed just like that. But and there were rumors that have been propagated that it causes cancer. Well, we have a study of about 7,000 patients which refuted this, right? So growth hormone is probably the safest one of all. It can produce a little hand swelling if you start going too fast, and you can get a carpal tunnel syndrome. But I mean, that's about it. I mean, it's super safe, and some people don't seem to benefit that much. It may be subtle, but other people really, it really helps them, improves their health in many ways, including their muscular development and their alertness and a lot of other things.
When is it mostly prescribed then? As I mean, we hear, of course, with bodybuilders, but kind of excluding them out. When is usually growth hormone? For what reason? Is this a person that their health is on a decline? Person dealing with weight issues? I mean, when do you see that mostly in the indication for growth hormone to be
Y-
prescribed, if a
Well,
person can afford it?
it's approved for AIDS wasting and little else. I mean, it's an
Hmm.
outrageous situation. You can still get a hormone doctor to prescribe it for aging, but it's off-label use, and sometimes it's not too dramatic. They can get started on it and they don't even feel it for a few months. But I have some friends that have been on this stuff. They're in their 80s. They've been on it for 15 years, and I think they made it makes a huge difference in their performance and their sexuality. These guys are still working. I mean, they're
Hmm.
yeah.
Okay.
It's another drug like testosterone that has been smeared by these doping allegations, right? Because of course
Mhm.
the bodybuilders and performance athletes use related compounds, and it's been made a Schedule 3 drug, which means it's watched very carefully. And the Senate and the Senate hearings that accompanied this transformation, the FDA, the AMA, and several other agencies testified that um, testosterone, for example, was virtually harmless and had many important medical uses, but they still
Mhm.
made it a Schedule 3 drug, and it has to do with the politics and this something they can grandstand about, such as the sporting use, which
Mhm.
I mean, you've got to understand that um, strength athletes use doses of testosterone, which are 10 times to 20 times. They start at 10 times the replacement dose that somebody like me might use. It's 10
Mhm.
times. So that's a lot of freaking injections every week. Um, and then they go up from there, and they do get gynecomastia because their estradiol levels go crazy, and they use these hormone blockers which are really shouldn't be used for anybody. For them, maybe it makes sense for a short period of time, but they typically end up getting the tissue cut out, so they don't have any more problem with it. Estrogen is good for men. It prevents Alzheimer's and prevents heart disease in men just like it does for women, and it has this additional benefit of preventing prostate cancer. So
Mhm.
when men take testosterone, it gets broken down to estrogen, and that has a very positive effect on the chance of you developing and getting bad prostate cancer.
Hmm. So I'm going to have to ask this question. I mean, I can chat with hours for and just sit down and have a steak with you and chat about hormones, but I often get this question with, and you touched on it a little bit with hormones. If a woman has had like a hysterectomy at such a young age, so I've seen that more common now than 50 years ago. We're seeing women because there's heavy bleeding, there's other things that aren't looked at where I mean, hysterectomy, in my opinion, and what I've seen in the practice is, um, when I work with a lot of women, I'm like, we get your blood sugar under control, we get your liver detox pathways under control, we get your stress under control, and their menses are just more normalized and they're not heavy, they're not as heavy. But most of the time the hysterectomy is there for the purpose of, because of the heavy bleeding and estrogen dominance. So what if a woman has a partial or full hysterectomy? um, are hormones appropriate?
Gosh, this is really hysterectomies are massively overused. Okay,
Mhm.
we cut out the uteruses of a third of our women before they're 60 years old. Same number for C-sections. I mean, basically, the gynecologists are off the rails altogether. The sweet spot for C-sections is probably 12% for
Mm.
the best mother's survival, right? But we cut out we do a third of these things as operations. Now, hysterectomies are easier to perform if you cut out the ovaries along with the uterus. They pay a little more too. So this is
Mm.
commonly done. And even if the hysterectomy is done preserving one or both ovaries, and frequently these guys will only preserve one because it's easier and they claim it's just as good, the ovary is frequently damaged. And I have many times seen hysterectomies performed in the early 40s or late 30s. And these women are in shocking terrific menopause, obviously by their symptoms. And when I check their hormones, they're zero, and I'm
Mm.
forced to stick them on hormone replacement, which turns them into the girls they were right before, and they're fine. So of course you think about hormone replacement if a woman's had a hysterectomy, because many times their ovaries are either damaged or they've been removed altogether. It's no one tells a man that he needs his balls cut off at any point. And for some reason, we think it's cool with women, and it
Mhm.
destroys their sexuality, sends them into menopause early. It destroys their intellects go earlier. I mean, it's a sad scene, and it's not really looked at too much because you mentioned the Women's Health Initiative study. That crazy thing, it was $1 billion study, and
Mm.
it was steered into the bushes by the people who did the study in order to make some sort of media splash, and they claimed that these hormones were evil, right? And they studied these outmoded hormones, the horse urine estrogen and the chemical progesterone, and they saw a few problems. They had a few rare cancers, and some of the symptoms weren't so good. But I mean, those things overall are net positive, even though they're not as good as our modern hormones. And by the time that study was published, those things were totally outmoded, and those drugs should never be used for long-term care. They have their uses for acute situations like a lot of bleeding, but for long-term care, and the outrage is they're still being advertised with direct-to-consumer advertising. There's only 2 countries in the world that do that. So okay, so sorry I went off on a rant or a tangent, Linda. Go ahead and bring me back to what you're
Yeah.
interested in.
Now about the safety for some women, because some, that have had the hysterectomy at such a young age, and then of course for some also, you had mentioned earlier too that um, maybe hormones aren't for everyone.
Well,
What's that small percentage or that hormone
okay,
replacement
so
is?
there are men who preserve their testosterone levels at 1,000 into their 60s and even into their 70s. It's not that common,
That's
but they
impressive.
don't need, yeah, they don't need testosterone replacement. They can use vitamin D, of course, which is a
Hmm.
steroid hormone too. And, DHEA and other hormones, maybe a little bit, but it's not as critical for them. But for virtually every woman, particularly a woman who's had a hysterectomy, they should be followed carefully for hormone deficiency. And they will do better and live longer if they get replaced. I mean, and they'll feel much better. And the drama that I've seen with, and the reason why I use those testosterone pellets, I mean, women like testosterone pellets because they get very even levels of testosterone. And for some reason, it makes them feel good. It feels, there's not an up and down. If you get an injection once a week, there's a little bit of an up and down, or even a cream. But with those pellets, they couldn't stop doing it. They couldn't change their mind about agreeing to the therapy. If they agree to get it, they're on for the ride for 3 months. And so most of them understood by the end of the 3 months, the whole thing was really good for them. And so I mean, I again, I can't sell. You shouldn't sell anything in medicine. You should explain it and let the people make their minds up. But a lot of the doubters were willing to do a trial of that, and at the end of a few months, they understood how good it was for them because they felt better. And if you want an index of how you're doing medically, don't look to some stupid laboratory test. You want to check yourself and see how you feel, how you're responding to exercise, whether your body and your spirits are working right.
I think that's a good way to gauge that, because so many times doctors are treating the lab and not the patient, and you have to look at it as a whole. And that I have just been screaming about that with patients all the time. It's like, you know what? Thyroid's such a big example. Like, my thyroid's fine. I'm like, well, what did they check? TSH and maybe free T4. You can't say that your thyroid's fine. You've got to do all this other testing. That's why I have a list even on my website of all the labs that we require from all our new patients, so that we can get a pretty good snapshot of what's going on with them. So this has been really interesting, very informative. Definitely going to use this as a reference for people to get educated. First of all, thyroid, like if you were mentioning, a lot of women will be on some sort of thyroid hormone because, one, we're seeing so many thyroid issues, and it is because I think a diet, lifestyle, a lot of environment. There's so much with that. Number two, the thyroid function also depends. Also, there's kind of like that dance even with estrogen, and then of course estrogen and progesterone and testosterone. It's just like there's a whole dance with all those and how they impact thyroid and vice versa. So I think it's really important for people to, and women and men, to really realize where they are with all their levels. So I think it's important that the proper testing, number one. Number two, to seek out a practitioner that is knowledgeable in the testing, and also is going to monitor you, because I've had patients that they're not on progesterone, but they're on estrogen and testosterone. I'm like, how could you not be on progesterone if you've been having this for how many years? And that just,
you should be on progesterone even if you don't have a uterus. You should be on progesterone because it has separate effects that are very positive.
Got it. And so that's always also, and then just know where your levels are, engaging, how are you feeling as well, and having that open communication with the practitioner that is prescribing, whether it's a nurse practitioner, a naturopathic doctor, medical doctor, to just have that communication with them, say, hey, I'm not feeling this, I'm not feeling great, or this is happening, and not be embarrassed about it, because a lot of times women don't ever want to say that I'm depressed, because, we can do it all. We're super women, we've had babies. So, yes, it's like I'm a prime example. I don't like to ask for help in certain areas of my life, but it's nonsense, because what I have learned now, especially, I have a doctor that helps me, even though I know what I'm doing and I work with so many patients. It's always great to have someone else to kind of have that bird's eye view of what's going on with you, because we'll never admit that we're wrong, or that we need help. That's very difficult. But I loved how you just kind of unpacked everything and the importance of thyroid, progesterone, testosterone, estradiol in particular, and even hitting a little bit on the DHEA and the growth hormone, because that is important, and how it's administered. So one more quick question before we leave. I know this is a lot, but I think a lot of the Women's Health Initiative, a lot of that was because of the synthetic hormones versus natural, and the bioidentical is what you're saying. Those are natural and they can't be patented. Is that correct?
Well, there are, you know, the companies have gotten around the patent thing in a few small instances. They're allowed to patent certain doses. So if you can
Mm,
find a patented version of these things, it's fine, but it's generally insanely expensive. So we've turned to the compounders, who are probably 5% of the pharmacies in the United States now, and they often produce excellent quality products, and your provider like you can
mhm,
tell your patients which compounders has done a good job. You've tested levels on people before, and so on and so forth. I just want to bring
mhm.
out one more important point. 99% of the time, in my experience, or maybe 90% of the time, if you're having trouble with your hormones, it's because you're not taking enough. That's a really hard thing to get through anybody's head because of all this negative publicity. Now, the exception, of course, is thyroid. You can take way too much of thyroid,
Mhm.
but if you get your thyroid tuned, it even helps your sexuality. I mean, it helps women's sexuality in a big way if it's just right.
Yeah. Awesome. I love it. Where can people find you? And where's the best place to get your books? I'd rather support you than Amazon.
Well, that's
I
very
said,
kind of you. Now, you can get my books on every platform. If you like to buy books anywhere else, Amazon, for all their problems, and I'm not fond of Amazon. You can find this book on Amazon. You can find Butchered by Healthcare on Amazon. You can go to robertyohoauthor.com, and you can download the first half of each book, and you can also download the first half of the audio for each book. So that's a good start, and you can learn a lot just from that.
yes, and doctor does mean teacher. You will always be a teacher. And I think it's a great way for people to learn. I've been listening to you. You're in my head.
Well,
it's,
that's very kind
it's
of you. Thanks.
wonderful. I love audiobooks, but I also like to get books and just highlight and make copies of certain pages for patients and pass it on and say, here, you need to get this book. But in this section, this is what I found. So thank you so much. There's so much amazing information. It's really going to help a lot of people just, make a decision, but um, really learn how to choose the right person to work with. So thank you so much, Doc. I really appreciate it. I know you told me don't call you Doc. You're still to me doctor
Okay,
because you're a
that's very
teacher.
kind of you.
You're still going to be teaching all these years, no matter what. And I love what you're doing. You've retired now, but I think you're probably busier even now than when you were working
I'm
because
busy.
your
Yeah,
passion for just really helping people and getting the truth out there. And I really want to acknowledge you for that because some people will just be still and be quiet and not say anything. And when we're out there speaking and sharing the truth, yeah, the people are going to throw rocks at us and going to criticize, but at least we're out here trying to do something positive and leave this place a better world. So I want to acknowledge you for that. So thank you so
thank
much.
you.
All right, we'll see everyone next week. And thanks for joining us and have a great day and make it a good one. See ya. Bye.